Hello, and this is my Global Health Project initiative. And this, for my issue, I decided to go with the ethics of treatment of patients with infectious disease. I figured that this would be a very relevant topic, considering what the world is going through. And I would like to talk about Doctors Without Borders and how I believe they have chosen to pursue the ethics of patients with infectious disease and how they align with Catholic social teaching. So before we begin, I'd like to talk a little bit about the organization itself. They were an agency founded in 1971. They've been providing medical services in places that really need them the most. They're an independent agency, and they really don't base their actions on the political or media agenda. They don't really place it on race, class, or religion. Their hard work and dedication to helping others actually earned them the 1999 Nobel Peace Prize. So they're very well known for disregarding things that we often associate with people's identity and just seeing people as people, humans as humans, knowing they need help and helping them. So it's very easy to see why they are so beloved. As I stated, they're a neutral organization, and they do give their services to anybody in need. They rarely take funds from governments to remain impartial from any political organization, any political agenda, and often their efforts actually go unnoticed by popular media. This is mainly because, they don't wait for the media to get their eyes on them to see what they're doing, like, look at me, I'm doing so much good. No, they don't do that. Because they immediately respond to an emergency, and often word gets out long after they've pretty much taken care of a situation. So whenever I started thinking about the treatment of infectious disease, it kind of reminded me of a quote from the H.G. Wells novel, The War of the Worlds. So in that novel, of course, with Martians, they come to Earth, they want to take over Earth, invade Earth. And spoiler alert, if you haven't read this novel, what defeats them? It's not the biggest creature, but as Orwell put it, by the tiniest creatures that God in his wisdom put upon the earth. The aliens were basically killed by viruses, they were killed by bacteria. And to me, this quote really emphasized the power that microorganisms and viruses have, and just, how easy these things that are so small, beyond the naked eye, can really change our lives. And I think our world is really starting to experience this power firsthand with COVID-19. And so because of this power is, I think, starting to cause a lot of people in the medical industry and in the medical field to make some rash decisions surrounding patient treatment and morality all around the globe. And you can definitely understand their position. They're supposed to, help as many people as possible. They have to weigh their options a lot, and, sometimes that causes them to make some very rash decisions because viruses spread quickly, so they have to act quickly. And more specifically, it's often presented them with this harsh dilemma, as you can see. Hospital beds really continue to fill up with COVID patients. Doctors often feel they don't really have a choice but to choose people who receive treatment based on, age, based on whether they have an immunodeficiency, or even something like, wealth or social rank. And already we've seen something like this happen in Italy, Europe's epicenter for the virus, where the elderly were being refused medical attention since they're more likely to die from the COVID because they're older, their immune systems aren't as strong. So many feel the resources need to be used on younger and healthier patients who are more likely to live. Now, right away, this presents us with a dilemma. This doesn't treat, you are immediately first of all, you're discriminating against somebody because of their age. Second of all, you're not giving them the care they deserve as a human being. And you're just really limiting them to a possibility that may not even occur. So yes, it's very likely that they will probably die. That's kind of what diseases do. They get rid of the old, the sick, and the weak. But at the same time, often these decisions do discriminate, and oftentimes, you've basically sentenced an entire group of people to die, essentially, and that isn't right. To kind of put things in more perspective, as of December 3rd of this year, more than 1 million people have died from the pandemic. And although most people are probably only going to experience mild or moderate forms of the disease, about 20% of people will probably need hospitalization to recover. And so last I checked, 64.5 million people had the disease. And so I did some quick math, and 20% of that is 12.9 million. That's 12.9 million people who are still going to need to be in hospitals. That's very easily going to be able to overwhelm healthcare systems of all kinds, and this just isn't a good situation. And it's something we're already seeing in the United States. And, we consider ourselves to have a very good healthcare system, and it's even overwhelming us. But thankfully, Doctors Without Borders has been helping, I think, to kind of lift some of this, take some of the burden, off of the healthcare system, and kind of help, as an independent organization, assist it. So in the U.S., they've been working to support people who often lack access to medical care. This is people who are, maybe lower social class, don't have as much wealth, maybe even older people who maybe are living off of retirement, retirement, social security checks or something like that. In Texas and Michigan, they've been helping the residents in nursing homes. They've been caring for them when hospitals can't. And they've even been helping in countries like the third world countries of Africa. And, they've been educating the public on, how the importance of hygiene and how the virus spreads. So, people can use that information to protect themselves and other people. They've even in refugee camps, they've set up these tents, these isolation facility tents, to treat COVID patients. And some of these tents even act as maternity units. So in a way, Doctors Without Borders is going one step further by providing other services like maternity units, places for women to give birth, places to take care of these people. So how is Doctors Without Borders, how does what they do align with Catholic social teaching? Well, the first rule of Catholic social teaching is to care for all people, regardless of race, gender, political belief, sexual orientation, or any other social factor. And, this is something they explicitly say and something they explicitly practice, in the way they work in so many different environments with so many different kinds of people. They don't discriminate against any kind of people. Like I said, they just see them as people. You can see this in how they work from, these big, rich, bustling cities, filled with, office workers and homeless people somewhere in between. Or you even have these like remote villages where even they don't have as much technology and access to healthcare. And, they also follow rules like protection of the poor and, how they work in these third world countries. They solidarity and they participate in seeking the common good. They want to seek the common good by obviously, helping people during this pandemic, by trying to help bring an end to this terrible virus that has ravaged our communities. And that is a way to help. And it could just be the very nature of the work they do itself that helps to seek the nature of the common good. Granted, Doctors Without Borders does support abortion, as they are a atheistic organization. But for the most part, and how they've been related to our issue right now, they do mostly follow Catholic social teaching. While they do support abortion, which does go against the dignity of the human person, that really is an entire other can of worms to open. But in terms of the pandemic and how they've been handling it, I'd say they've been following Catholic social teaching very well. In this image alone, I want you to try and identify where Catholic social teaching is being used. Okay, right away we can see this man is, he's not obviously in the nature of the work itself. He's, caring for the poor. He's caring for a person who doesn't have as much money. As, this appears to be kind of maybe a little bit run down facility. He's helping both of these people. It appears he's not discriminating against them based on their age or gender. He's helping to seek the common good by getting rid of this horrible disease. And, it's very easy, I think, to find where Catholic social teaching is being used in this picture. And, here's just a few of my quotes, my citations and sources. And that's it. I hope you've enjoyed this little presentation. Hopefully it's 5 minutes, and hopefully you learned something about Doctors Without Borders. Thank you.